Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, Hee Hee. Now let's get to the good stuff. Dr. Lizzie, welcome to the show.
Thank you so much for having me, Hee Hee. I'm so glad to be back.
I am so excited to have you on the show again. Now, last time we talked about chiropractic care, but not in terms of oral restrictions, not in terms of how it impacts or how it can fix things that might be going on with our baby. We just talked about it in like general health terms with our baby. Today, I want to talk about specifically tongue tie and chiropractic care. And I would love for you to start us out there. When we're thinking about a tongue tie, what is it? What are some signs that you might have one? And then how do you know if chiropractic care might be a good option for your family in terms of chiro care for specifically tongue tie?
Such great questions. And I feel like there's so much more questions than almost answers that we have. And of course, like with so many things that I'm sure you talk about, I've discussed some broad general trends, things that I see over 11 years of practice. But of course, every case is very different, and each individual baby and mama diet is going to need different specific care. And we'll need actually hands-on practitioners no matter what is going on. So I just wanted to just have that as a general overall disclosure a little bit. Yeah, what is a tongue tie? A tongue tie is basically, okay, so I'm going to back up. We all have this tissue underneath our tongues, and that is called a frenum, and it connects basically the bottom of our tongue to the floor of our mouth. Similarly, we have a frenum on our lip where it connects like the gum line to the outer lips. And whereas everyone has a frenum, some people have very tight, restricted frenums, more or less, like it is a spectrum, like everything, that in some cases can impact tongue mobility and oral function. So this is really what we're talking about when we're talking about tongue ties. It's okay, something structurally, anatomically, or both, which again I'll talk about in a second, is impacting, restricting this tongue's ability to move freely. And where we often see that come up with young babies is in nursing or bottle feeding, when they're not able to get a comfortable latch, an efficient deep latch. It's often really shallow, or sometimes they're often like popping on and off, they're clicking. If the mother is breastfeeding, they might notice compression to the nipple, pain to the nipple, damage to the nipple, like cracks and bleeds. If they're bottle feeding, they might hear clicking or slipping off the bottle, milk leaking outside of the baby's mouth of the bottle or breast. Sometimes there's other signs that can show up as well, such as recessed jaw, generalized tension. Sometimes it's also related to torticollis, like a head turn preference or other physical restrictions. I just wanted to back up a little bit about when I said like structural or anatomical. I actually put these ties into these two big categories, and sometimes you can have both going on. But let's think about, okay, so sometimes there is this physical anatomical structure where sometimes it's so obvious we can even see it, like an untrained professional can see it, where there's literally like this skin of tissue connecting the bottom of the tongue, like at the very tip sometimes to that bottom of the mouth. And it's sometimes even the end of the tongue has a little heart shape or forked appearance to it because that frenum is so tight. So that is an anatomical tongue tie where this tissue at a certain point in our embryonic development, this tissue gets resorbed and disappears basically in the body. Just for example, we had webbing between our fingers, and at some point during our development, that webbing gets the cellular messaging to reabsorb. And so we are usually not born with that webbing. For some reason, there's different theories, but in tongue-tied babies, that tissue does not get reabsorbed. That tissue is staying throughout the rest of the embryonic development and after birth. And so that is that physical friend that sometimes ENTs or dentists or doctors in the hospital may even physically cut or release that with a laser or a pair of surgical scissors. I also consider something that I call structural ties, where let's say there's tension in the skull, there's tension in the neck, there's tension in the jaw, sometimes related to an anatomical tie, but sometimes related to the birth process or some other physical stressor that came about in this child's history. Sometimes that tension can make compensation patterns and tension patterns that makes it hard for that baby to use their tongue and jaw fully. And so that is sometimes where I come in as a chiropractor. I realize I'm just flowing so much information at you. Tell me if I need to like slow down or back it up. But
No, this is awesome. This is amazing.
okay, cool. So let's think about a baby struggling to nurse. Again, that's usually like the first sign, often the first sign, though not always. Sometimes that's starting with a lactation consultant or the pediatrician. Maybe someone's identifying this or saying, okay, this isn't going right. We need some other kind of service, intervention, help here. Let's say if I'm meeting the parents first, even if there's like a suspected tie or maybe there's a tie, I'm still going to assess and treat any of these tension patterns, specifically in the neck, jaw, and head. Sometimes that can positively impact the nursing or feeding relationship without any other intervention because we're reducing this tension. The child maybe can more freely move their head, it's more comfortable and easier for them to open their mouth wide to get a good latch. Or if there was some kind of neck turn preference, neck tension, maybe it was physically hard for them to latch on like the left side. This can all help with that. Sometimes we get results with that. We get some results with that, but then some of these persistent issues are still happening. That is often where we can look at maybe this particular child, maybe they do need some kind of frenectomy or physical surgical release of the tongue or lip tie or both. Even if that is necessary, I find personally, and I find a lot more providers that do releases more recently are slowing down a little bit with the release and saying, look, let us get this baby some body work first, either with a
Nice.
chiropractor, it's so nice, or a craniosacral therapist or occupational therapist, pediatric PT, maybe some combination of all of these things, maybe the parents doing some home exercises, oral mobility and strengthening work at home. This is so important for a variety of reasons. One, if they go ahead and do the release, this is going to make the release easier and more targeted and specific. It's also going to help that baby's rehab and recovery after the release. It's also starting to activate some of these oral skills and muscle patterns that is hard for babies with ties to learn how to effectively do. So this can all start that training process before the frenum is actually released. Again, in some cases, we start these therapies and the parents and the providers realize, oh, maybe we don't need further intervention. Maybe this baby's tie does not need to be released because we're seeing the functional changes that we wanted to see with just this myofunctional therapy, with the body work, with the other more conservative interventions. So I see almost no downside to starting with the body work because it's like it's either going to help with the release if the release is indicated, or it's going to solve the problem before the release is indicated. And I find, again, some specific providers that I tend to work with closely and consistently we're sharing clients in this area that has been more of their approach recently. And we both notice that babies are just getting better results, which of course at the heart is every provider who is recommending these kinds of procedures. We hope and we want and we really want to trust that this is like where their intention is,
Hmm.
what is it the best for this parent and this child.
Yeah. Okay. How long are we waiting to see if that body work works or not? Because the whole time that we're doing this, we're also really probably struggling with breastfeeding. So there is a fine line that you want to walk. And I know that it's on people's minds of, okay, but I'm also struggling to breastfeed. So I can't just do this forever.
Such a good point. It's such a good point. So I'll to give an example. Again, every case very different, but
Sure.
I do find that with kiddos, especially little kiddos. Now, if we're talking about like older children and adults, which we might get into later, that's going to be a little different timelines. But with kids, sometimes a client that I'm currently working with, this is a 3-week-old baby, okay? So it's not a very long time no matter how we look at it. He's only been around for 3 weeks. The parent was really clued into it though because her first child had a tongue tie and she I find the early to intervene are often parents that are like, I've been through this rodeo already. I know what to look for and I know when something's not quite right. And they're also, I think, much more clued into their own intuition. But she knew there was a problem right away. She brought this baby literally the day after they got home from the hospital to her trusted pediatric dentist. The dentist was like, look, they're like 1 week old. Let's just hold off here. Let's do some body work. They suggested chiropractic to start. I think I saw this baby 3 times. We saw some increases in, like, the efficiency. They were getting a little more volume with each nurse, but the mom was still like, "This is just coming off and on." She was still really struggling. Now, with this mom in particular, she already she was the one that was pushing for the release. This was the dentist that was, "We can hold off on this." So with her, I was like, "Look, we haven't seen these results after 3 times. I think this is warranted. We're not seeing the results we want, and this is clearly something you're comfortable with, something that you're expecting and want to do." And she did not want to wait. There's other parents where they clearly are like, "This is the last thing I wanna do is put my baby through any of this pain or discomfort." They might have a longer timeline, and again, that sometimes that's warranted clinically based on what's going on with the kiddo, but sometimes it's the family's preference and their own personal philosophies, and I think that is actually still really important,
Sure.
especially when we're talking about, like, a 2 to 3-week-old baby. Babies Adju adjust to adjustments, but they integrate adjustments and body work really quickly. Okay, this is not someone we're talking about with decades of scar tissue or patterns to reverse. Even if this has been going on in utero, which it has, that's still months. Okay, and these babies are also, their skulls are expanding, their jaws are growing. Even if we do nothing, there's going to be change. So I sometimes see changes in like 1 to 4 visits.
Mm.
If we're not seeing those changes, whether that's tongue tie or anything, it's always, okay, what else we're missing something here, whether that's we need to intervene with the next stage for this frenectomy, or we should consider OT, or let's get this referral for GI or something. There's some other puzzle piece that we are not getting our hands on. But not to say all the problems will be resolved, but we want to start to see some progress, at least like moving in the right direction pretty quickly.
Yeah, cool. Okay, I know that's really promising to hear. Okay, you mentioned mom saying, "Oh, my other baby had this." Is it genetic? If you have one baby that has it, are you more likely to have a tongue tie or some sort of oral restriction in any future kids that you have?
Short answer, yes, I believe this is like the rabbit hole of all rabbit holes. I am not going to be able to
Okay.
go into the full, but one The leading hypothesis that, at least in my understanding of why tethered oral tissues are here, are prevalent in babies or showing up in babies, is this mutation of the MTHFR gene, which I'm sure has come up in other conversations like prenatal vitamins, all this other thing. So basically, the body is not methylating properly. And this little splice in the gene is preventing that signal of those midline structures to get resorbed. And so if you know you have this with your first, there are some things you could do, like prior to a second pregnancy, to try to mitigate some of that methylation issues in both yourself and also future pregnancies. But I think it's probably, I think what was probably the most preferable is to be like, okay, my kid had it. Let's just like assume there may be something going on, and then like we can rule it. If it's not going on, great. But
If it is,
kind
you're
of, yeah,
prepared.
exactly. And I
Yeah.
think in some ways that is a lot easier for a million reasons. Not only you're prepared like mentally and emotionally, and you know what signs, why something's not right, what's not your fault. You also like probably if you're still in the same location, you might even have the same IBCLC, the same dentist you can call, the same chiropractor, the same OT. And like that, it is so overwhelming. As you said, this is going alongside a baby who's not nursing, who's your nipples are cracked and bleeding, your baby's not gaining weight. Like it's, and you're like still bleeding out of your vagina
Yeah.
or you're recovering from major surgery. This is all happening in those first weeks postpartum and after your first baby. Everything is overwhelming. The second time around is a very different story for a million different reasons. And that is one of them. Yes, you're prepared in every different way. And you can be like, okay, like, but I've also had babies. I've worked with parents who their first baby, there was like zero issues with nursing, nothing at all, no problems. And then the second one, more problematic, and vice versa. Like this couple, the family I just mentioned who I'm working with, obviously still concerns, but she keeps telling me, she's like, this is nothing like his older brother. Like we couldn't even do this. Like he wasn't even gaining weight. I couldn't even bring him to the breast. So it's not always necessarily like this is going to be exactly the same as like every birth is different, every pregnancy is different, every family that baby's born into is in a different place than that other baby. But yes, I do think if you've had a baby with ties, yeah, that's something you should keep your eyes out for. Just if you had preeclampsia, you're going to be looking out for preeclampsia in a second pregnancy, or gestational diabetes, or um, hip dysplasia.
Yeah, all the things that are patternistic. Did I just make that word up? Maybe.
It's a great
Things
word.
that are
Yeah.
things that are patterns, things that we know. We have a track record, right? You have a track record, even if it's just one pregnancy of having preeclampsia. It doesn't mean you're going to have preeclampsia this pregnancy, but we should be on the lookout because we know the last time it did happen. I love that. Okay, so if a baby was struggling to gain weight, and then we
Mm.
found out that it was a transfer issue, is
Mm.
that baby a good candidate for chiropractic care and possibly a tongue tie evaluation? Yes, big resounding yes. Okay.
Yes, I'm nodding my head. There could be a lot of other reasons too, but yes, that is one of the biggest flags to me. If mom has a copious supply, it is not a supply issue, and yet the baby is not able to effectively transfer that milk from the breast and the bottle into their mouth. That absolutely is like tongue not
Yeah.
coordinating well with the mouth, not doing the proper suck, swallow, breathe. Again, I always encourage IBCLC should be the first stop. I really do think so for any feeding disorder, not only because again, if a baby's come to my office, they've already tried all the positioning stuff, the latching things, that is where they should start because a lot of those are going to just fix that problem.
Yeah.
And then again, it's like these higher levels. It's okay, but this isn't helping, or that we helped a little bit, but we're still struggling on that left side, or they're transferring really well at night, but not during the day, or some other factor, something else is happening. And yes, chiropractic can be a fabulous way to help with that transfer issues and potentially would want them evaluated for the ties too, but that's not necessarily what's happening. But if there is yeah, I'd want it ruled out for sure.
Yeah. I like that hierarchy. And I think a lot of people probably find comfort in that. Like, all right, let's start with positional changes. Let's look at your latch. Okay. Next level, let's get to chiropractor. And then maybe the last level, if all of those combined don't work, we can look at some sort of revision.
Yes.
Okay.
And
In
just
terms,
to add, oh yeah, no, and just to add,
yeah.
not losing any of those lower levels, right? IBCLC should be on board the whole time. Oh, we need to add a chiropractor, still consulting with the IBCLC. Keep that conversation. Oh, we also need to add in a pediatric dentist, perhaps. We're still going to chiropractor. We're still going to IBCLC. And there are like a good pediatric dentist who's doing ties, like should not even be working with a client who's not seeing an IBCLC. They're just, it's just, we can't just treat these little disparate parts, right? I really think the IBCLC is the one that brings it all together more so than often a pediatrician, specifically
Yeah.
for feeding issues. But I'm so sorry to cut you off. I just think that's such a good, because the hierarchy's there and we don't lose the bottom tiers. It's like we're just adding that, and it almost can work in reverse. We see the pediatric dentist once, maybe twice, and then we're coming back to chiropractic care. And then it's okay, we're getting to this new stable. And then it's, are we still checking in with IBCLC, making sure everything, the weighted feeds are still going well, all that stuff.
Nice. No, don't apologize for cutting me off. That was awesome information. I know that it can feel so overwhelming to even think about what the care is. We talked about it's so overwhelming to find someone you trust and to seek out these people in your community, but then you have to think about, okay, what is this going to look like long term? And a lot of times it's just so overwhelming. It is almost a deterrent in itself to think about, oh my gosh, we're going to have to do this for the next couple of months. Okay, you
So
had
true.
shared about older kids and adults. So talk to us about what it looks like if you don't get this fixed in your baby, or maybe you don't even pick up on it. Your baby has a little tie, but it hasn't been problematic and they aren't exhibiting like a lisp when they're younger and they speak perfectly fine. What does it look like to have a tie as an older child or adult after you've been functioning with it for the 8 years to 50 years?
Oh, I love this question. And because we know each other through social media and real life too, I've been on my own tongue tie journey.
Yeah.
About 6 weeks ago, I actually got my own tongue tie released as a 40-year-old. So I have so many thoughts on this. I'm also going through this journey with my 7-year-old. So I have two children. I think with the first, it was going fine. She was gaining weight. I wasn't having pain. It was, oh, we're functioning. This is fine. Why would I was like, this is great. But as she got older, and so I didn't do anything in terms of a tongue tie release. But as she got older, there were just some signs that started to piece together more. Yes, I said nursing and feeding is often the first one because that's what's happening with a baby. That's basically all they're doing. With older kids, you sometimes see issues with certain textures or swallowing habit. Again, once I got my older daughter assessed, we were realizing like she was actually clearing out a lot of the food in her mouth with water rather than with the strength of her tongue and proper swallowing. So I love how you said like you've been functioning. It's yes, our body is so wise and so smart. We're going to figure out a way to swallow, to breathe, to sleep, to do this stuff. Is it going to be harder for us? Probably if we have a tie. And have we maybe developed a lifetime of compensation patterns to be doing that stuff? I can
Also,
tell you,
yes.
yes. So it's okay. It's like a different approach. What are we measuring? Did my kid have a lisp? No. Did she have speech delays? No. Did she have gross motor delays? No.
Wow.
So why am I looking at this now? Okay, what am I noticing? One thing I'm noticing is she's a toe walker, which means she walks on her tippy toes a lot more than typical. When I first brought her to a myofunctional therapist, someone who works on the tongue movement and mobility specifically, this woman was basically like, "Oh, anyone who toe walks has a tie." I was like, "What?" But it's
Wow.
basically this body's response to this full fascial tension throughout our entire body, starting from the tongue. She also does mouth breathing when she sleeps, has some snoring. So many things. Sleep disorder is also on this spectrum where does my 7-year-old have obstructive sleep apnea? No. But is she sleeping with her mouth open and then which inflames the adenoids and puts her into less deep sleep patterns and then can also affect other things. I don't even remember where I started. Oh, the sleep. Okay, yeah, the sleep thing. So it's this process. It's this gradual spectrum of disordered development, basically. With me personally, as a 40-year-old, were there symptoms that I was like, "Oh, I know this is from my tongue tie?" No, there were things that I went through my life just being like, "Oh, I have headaches. Oh, like I have mid back pain. Like this is something that is just part of my life." As a child, I had this like weird nervous habit where I would literally crack pop my jaw back and forth. I just thought this was like who I was, who I am. It's hard to know when it's the only body you have what's normal. This is my normal. This is just my body, okay? And then like I had these headaches. I found chiropractic as a child. That helped me tremendously. Did it stop them? No. Okay. I'm on this own journey of just learning things about my own body and my posture and doing yoga and getting adjusted, all this thing. And then in my own clinical practice and in my own motherhood journey is when I really started learning more about these ties, honestly, in the last 5 years, which also as a community, we've also learned so much more about the ties and the implications these last 5 years. Like it's not just me, but which made me feel a little better. But it was like, wait a second, are all these symptoms, is this physical tension that is in my body adding some layer to all of these other symptoms that I have? When I had first that assessment with a dentist and my myofunctional therapist, it was so humbling. They're basically like, "You're not swallowing right," or like, "You're swallowing with your neck muscles. You are tongue thrusting every time you swallow. You are," what else do they say? They're like, "You're moving your jaw every time you're moving your tongue." And I'm like, "Huh?" And they're like, "Did you know that your lips and your tongue are supposed to move independently of one another?" No, I didn't know that. Please help me. So it was like all this retraining of basically like undoing these compensation patterns that my body had so smartly developed over 40 years. So that, again, the myofunctional therapist, you have great articulation in your speech. It's not hard to hear what you're saying. I didn't have all these symptoms either, but it's okay. My body figured out a way. If I can take out some layer of this tension, even at age 40, will some of these symptoms change? And I got to a place in myself personally where I was like, I have very little to lose. This is a very, for me, very low intervention surgery. I am almost very curious about it. I have done all this prep work. I just want to see what can happen with it. And so I did do that. Did you want to hear specifically about like my recovery or that process?
Yeah, absolutely. I think if you'll share, like, what was your prep? What was the actual experience like? And then what did your recovery look like? That'd be super helpful. And listeners, I know it's going to be different. Dr. Lizzie being 40 is going to be very different than your baby being a newborn. And we talked about the reasons why those things are, but I think it would be very helpful to imagine what Dr. Lizzie went through when you are deciding in this process for yourself and your family, but also if you decide to have the revisions, it can help you understand what your baby is feeling and what they are going through, similarly to what Dr. Lizzie experienced. So take it away. I'm so excited for this.
Yeah. No, absolutely. And I honestly think it helped me also
Oh,
in
as a
my clinical work
practitioner.
be like, oh, yeah. And
Yeah.
of yes, it is very different than if I was like a 3 week old. And one of that is that I was very much prepared. Like I knew what was happening. I wasn't nervous about that because of that. So what it looked like for me was I started with this dentist that I had worked with professionally. So I knew her well. She took measurements showing me with numbers how little I could open my mouth and lift my tongue and do all these things. I know it was wild. And I was like, and she's, yep, yeah, got a tie, but we're not doing anything today. You're going to go start work with this myofunctional therapist and she'll let me know when you're ready. So my myofunctional therapist basically has these criteria of measures of tongue function and tongue strength that she's once someone can do these things, like the specific like lengths of time, 30 seconds of this, 10 rounds of this, whatever, of these like specific tongue exercises, then your tongue is prepared for this tongue tie procedure. Because the thought is, okay, 40 years of not being able to use this tongue properly, if we just cut it today, like you're not going to know what to do with it. It's imagine if you were getting like a total knee replacement, but no prep, no rehab. It's just, oh, we're just going to cut a new knee and you'll figure it out. So we're training the tongue to like work towards the mobility that we want so that when that actual restriction is released, the tongue like already knows what to do. It's already trained, right? And I'm doing it with my hands, like we're literally helping train to bring the tongue to the roof of the mouth in doing some of this work. So she's teaching me with the training, the exercises, and also doing some physical manual like release underneath the tongue. There was a moment I was like, I felt the back of my tongue on the roof of my mouth and had a realization. I was like, I have never felt this. This has never been to the top of my mouth in 40 years. I didn't know that was supposed to be where our tongue sat. Again, it's just no one ever checked it on me. No one ever talked to me about it, even in chiropractic school, even going to a dentist my whole life, the whole thing. So I worked with this myofunctional therapist for about 6 months every week, doing these exercises, doing these stretches. And then when I started to get to this place where like you're meeting these criteria, your tongue is strengthening, you're able to do these things, now we're ready for the release. And so went back to the dentist, scheduled that. And then in concert with the myofunctional therapist, because she wanted to see me like the day before and then 3 days after, like this very important timeline for the healing. So a lot of prep work. The procedure itself, I think like me in the chair, the whole thing was like 12 minutes. So not very long. And it was a very slow. This specific provider uses a cold laser to do the procedure, which cauterizes the wound as it goes. I'm awake the whole time. I'm using my tongue to actually get function. There was a topical anesthetic, so I wasn't actually feeling that. And it was very slow and deliberate. It was like, okay, we're going to release a little bit. And then I would hear the provider be like, oh, that like the tongue just sprung up on that. And then they're like, oh, we're going to do, there's a little bit more here. Oh, the right side's a little tighter. It was not just we're cutting and then we're out. It was like very adaptive, like reactive to my specific tongue and my specific frenum. And then for an adult, at least again with this provider, with a baby, this is basically left as like a open wound that we stretch to prevent reattachment. And as that baby heals, because they're like mouth is still growing and healing. With adults, it's a little different. And I actually had sutures. I had stitches across the wound under my tongue. I know he's giving me a look because that was the most uncomfortable part. Like, was it painful? Not really. The very that day, in the moment, I had topical anesthetic. The stitches were awkward. I had ibuprofen, I think it was 3 days of pretty regular dosing of ibuprofen, which they were encouraging me to do so that I would be able to maintain mobility. The hardest part was talking and eating. Really hard for me to not talk a lot. I was like, "What?" So I did take a day off from work. I probably should have taken more. If I could do it again, I would have had 2 days of chill time. It was like the ibuprofen, I for about a week, I was eating soft foods like yogurt, applesauce, smoothies. I wasn't having my normal foods. It wasn't very comfortable to chew. I didn't want, like, things like seeds or nuts, like, anywhere near there. The stitches started to resorb and fall out, I think 3 or 4 days after, and I stopped needing ibuprofen at that point. I'd say by 5 days after the procedure, I felt like I was just back to pretty much normal. Now the post tab is, like, continuing with my myofunctional therapy, continuing to retrain my tongue, now almost at this, like, next level, more complicated exercises, like, series like, I'm now retraining myself we're retraining how to swallow, so I'm not tongue thrusting, using different like, parts of my mouth that I honestly didn't realize were independent muscles, which I realize is crazy because 'cause I've had all this anatomy training, but I liken it to, do you know the first time that someone finds out that their pelvic floor is not just like a vagina, but it's like dozens of different muscles that all do different things, and you're like, "That's just my vagina." It's actually, no, this is like 40
Yeah.
different things.
Yeah.
It's the it's like the same thing for your floor of your mouth or your tongue. You think, "It's just my tongue," and you're like, "No, did you know there's actually, like, intrinsic and extrinsic muscles, and some spread the tongue apart, and some make it skinny, and some lift the sides, and some lift the middle." And I had never been able to isolate those. I never even knew they were supposed to be isolated, but it's been very humbling, it's been fascinating, and what it has shown me, I think, while yes, do I wish that I had that procedure at 3 weeks old? I do. Maybe
Mhm.
I wouldn't have had all of these things happen in my life. Who knows? I would have had a totally different body. It's never too late. And if it's something that you're still struggling with and think this is your pattern, I have a lot of parents who, after going through it with their children, they're like, obviously it came from somewhere. Or then they're going in to see the dentist, the dentist, look at your mouth. I, it's never too late to make a change. This dentist talks about 60-year-olds, 70-year-olds getting these releases and seeing huge differences. Excuse me. That being said, I do think having gone through this as an adult, and now with my 7-year-old who's like along this process where she's still not ready to have her release, but like we're working with the myofunctional therapist and body work too, is that it really has colored my own personal experience of, I'm like, if there's a baby that has a tie, I think if someone's asking my personal opinion, I will tend to be like, look, if you're on the fence, I think do it
Mm-hmm.
because of where I'm from, where of like, I wish I had done it. I'm 40, I just did it. Does that mean I'm recommending it to everyone? Absolutely not. Does it mean everyone needs one? Everyone has one? No. It's, as I'm sure many of your listeners are aware of, there's been some controversy about it and people saying like, oh, everyone's just diagnosing everyone with a tongue tie. And it's just about money. And is there some truth to that with some providers? Perhaps. Does that mean that there are no kids that have tongue ties or that can't greatly benefit from releases? Absolutely not. The truth is somewhere in between. But when people are like, oh, I'm on the fence, they think I don't really need it, but I could. And I'm like, if it was up to me and I could go back in time 40 years and had any agency over my medical history as an infant, I'd be encouraging my parents to do it because, again, it's never too late, but there's also things like this isn't going to change my nasal passage development like it would in perhaps a 3-week-old.
Will your daughter have stitches too? Do you know at what age they start giving stitches?
Yes, I believe she will, and that is definitely been like, "Oh god, okay, we're not
Yeah.
quite ready for this." She has some other things going on. We've been advised that she actually gets some palate expanders
Oh,
so
yeah.
that, because again, part of the tongue's job when it does properly rest on the roof of the mouth is that it literally expands and widens the palate. So if someone's tongue is so restricted that it can't reach the roof of the mouth, like mine was and like my daughter's is properly, then that palate is not getting that input. And so it's often very narrow and high. So if they released her tongue, again, there wouldn't even be enough space for that tongue to sit properly. So that's why it's a little more process with her. I do think stitches involved. I don't know the age where it's this is yes, this is stitches, this is not stitches. But again, this is going to be really different provider to provider. I do feel like the provider that I worked with and work with most closely, she has this informal of we're either going to do this to this baby like before they're 6 months or like after they're 5. Like it's a really hard procedure to do on a toddler and even some younger kids, not because of the physical issue at all. It's more just like the compliance of that post tab, the comfort with being able to sit
Totally.
there and get stitches in your mouth. So there's other considerations that come into play that's not just clinical, which is when we're talking about a 3-month-old baby or younger, it's obviously very different. Not to say you can do whatever you want to them, but it's you have a lot more freedom.
Yeah.
They're not gonna be, like, shoving your hand out of your mouth or being like, "No, mommy, you can't do that," whereas, like, my 7-year-old very much can.
Yeah, that autonomy matters a lot, how much you'll be able to support them in that post tab. Okay, do you have any, or are you familiar with the numbers of about how many babies we think, what's an appropriate number, right? We talked about like 100% of people don't have it and 0% of people don't have it. Do we have any idea of how many babies may actually have some sort of oral restriction?
That is such a great question, and I don't know. So I don't wanna
Yeah.
just make up a number because I would just be making it up. In my practice, I feel like it's really high, but I also
Okay.
that's a really skewed.
Totally.
Yeah, like, I also have 80% breech babies, but that's not normal, that's just because
Right.
all the people with breech babies come and find me. So that's the same thing, like, I even babies who just have nursing issues, like, a higher percentage of those babies are probably gonna have ties than just any baby, and most babies who are not having any issues are not coming to see a chiropractor or a pediatric dentist. This is true.
Yeah.
I bet the number is out there, at least a pretty good estimation, I just don't have one, but it does feel like in some ways, it feels like it's more common than when we were growing up. I think
Mhm.
like a lot of things, it's a combination of different things of yes, we are probably getting better at identifying it. There's also a lot more parents certainly than when I was growing up breastfeeding, and so identifying those issues earlier, I think too. There's a lot more sharing of information parent to parent through Facebook and social media, and one of my patients found out about tongue tie just through Facebook parenting groups before she even had a baby.
Wow.
I know, I'm like, "Whoa, okay." There's benefit and risk to that, but I think
Sure.
overall knowledge is good, especially if the person who's taking it in takes it in the way they wanna, process that. There's also stories of, like, midwives long time ago, like, releasing kids' ties before they even told parents about it. So it's they used to keep, like, a long fingernail.
Yuck.
Yeah.
That's
So
disgusting.
it's okay, do we have great comparisons of that? Not really. I do think that the prevalence might be increasing a little bit as well. And we can also I also again, very different, but I compare it to autism, for
Mm,
example. Are we getting really much better about identifying people on the autism spectrum much earlier? And yes. Are more kids also having autism? Yes. Both can be true.
yeah.
And when we're looking at things like gene mutation and epigenetic factors, such as things related to tethered oral tissues ties and autism and other things, that I think that it's the factors are so complicated, so multifactorial, but it's hard to ignore. It's not just we're talking about it more. There's also just more kids getting
Yeah.
affected, in my opinion.
I agree with that. And that's what we see as well. We find that we actually do refer a lot of our clients to a pediatric dentist after they have tried these things to say, okay, if chiropractic is not working and we're still having trouble feeding, go get an evaluation. So I work closely with the same provider you do. So listeners, if you're in the Boston area or really like New England, she's definitely worth the drive. Reach out to Dr. Lizzie or I. We're happy to share the provider that we love and trust. In my opinion, I think she's the best in the area. There are other people who can do it as well. So she's not your only option. But I have found, and one of the things that really made me trust her so wholeheartedly was the fact that she doesn't operate on you just because we send you to her, right? She has her staff works closely with us when we share a client, and they will write us back and say, we had an eval with this family, so sweet, love the family, also they don't need this, we
Yes.
recommend them do X, Y, and Z. And it's like chiropractic care, continue body work, try this stuff with breastfeeding, things like that. And so it just, I think there is that balance of finding the provider that's right for you as well in this journey, because something obviously that keeps coming up is just like, this is a lot. You're in a very vulnerable space in your pregnancy and postpartum time. You've got other factors. There's so many things to think about. It adds to your to-do list. It is a long-term commitment. So find a provider that you feel safe with. Although it can be really hard to find pediatric dentists that do these procedures.
Yes. And that's yes, I couldn't agree more. I have the same exact sentiment about Dr. Heidi, this provider, where
Yeah.
I'd be like, "I'm pretty sure this baby needs to be released." She's, "I'm pretty sure they don't." I
Mm,
That has given me so much more respect because, yeah,
totally.
again, that New York Times article, so much of the criticism is that these people are just quick. Anyone who walks into a pediatric dentist, they're gonna cut them. They're gonna suggest a tie.
Which is
If
probably
that
true
is
for some people, some providers, you know?
exactly, and if you're feeling pressured to do something that day, that's like a big red flag.
Totally.
Again, even if this dentist is, yeah, I'm pretty sure they need the release, but they're like, don't do it today. Let's start with the body work, start with some other things. So you should not feel pressured or coerced or stressed into doing anything
Mm,
for your baby at any point, I think,
by anybody.
by anybody. That's such a good point. And even though it can often be urgent and important, it's not an emergency situation where this baby's not breathing or some it's not if we don't get this done today, it's all over. So there is a moment to like take a moment to breathe, to go through the framework of benefits, risks, alternatives, doing nothing, checking in with your gut, checking in with your partner. Oh, and I think that it's starting with the IBCLC.
Yeah.
That's where it's so important to tie it all together too, and to identify when it's, "Okay, next level, we need a little more help here. This isn't working."
Build your team, build your toolbox. Yeah. Cool. Okay, my last question for you, and this is just because I'm nosy Rosie, but what talk us through your inner dialogue when you felt your tongue hit the roof of your mouth for the first time in your whole life? Because I am having such a hard time conceptualizing that. My tongue does live on the roof of my mouth, and I never knew that was correct. It just did. And then online, I was like, oh my God, I'm doing it right. I didn't even know you were supposed to do anything with your tongue, right? What was your internal dialogue? Because for me personally, I'm picturing like fireworks and like a happening
I
above
know.
you, and you're like, oh my God, what is this new world?
It's so true. And my providers prepared me for that. They're like, some
Okay.
people cry. Some people like feel like they're in different skins. Sometimes they have to go and change how their whole like seat is set up in their car. Cause it is like your body's differently. So I will say, like that moment of when my tongue hit the roof of my mouth, that was pretty crazy. I was like, wait, is this what it's supposed to be like? Like it's what it, again, it's like asking a fish if they're wet, and it's I think I'm wet. I don't know. It's just my tongue's always been like this. Like you don't know if that's the right way. It's just the way your body is.
Totally.
During the actual frenectomy, I didn't have this like instant moment of, oh my gosh, everything's different. My whole body feels different. I felt a big release. I felt like a lot of energy and nerves because it was like so much building up to this moment. But it wasn't like a big, I didn't start bursting out in tears or anything. I did feel like instantly like shoulders felt lower. That was cool. And then that day I was exhausted. I like fell asleep on the couch, which is not very typical for me. And the dentist was like, "Oh, yeah, we think of it as this tiny little thing, but like the impacts, like digestion, everything." So that day, I think my body just had to absorb this change and be like, "Whoa, like a lot has just happened to you." And then now I'm like 5, 6 weeks post, still relearning how to use the tongue. I've had a couple colds, so that has affected like my mouth breathing because if I got nasal congestion, I was like, it's messing me up. But some of the biggest things, I've had less headaches. They have changed slightly. So I feel like there's like different triggers to them, which I'm still interpreting.
Okay.
I also I do yoga and have for many years, and every time I would do like a cat cow like stretch, I would always feel this pulling in my mid back, and I just thought that was like my body and that's how your bodies feel. And the first time I went to yoga after release and I just didn't feel that pull, and I was like, "Hold up. Is this how people's bodies feel?" And then and one other thing that I'm going to share because this is blowing my mind and your postpartum pregnant audience will absolutely love it is that so I am now 3.5 years postpartum with my second baby and have had urinary urgency issues and like I've seen pelvic floor PTs. And then like it got resolved. I had a flare up, went back to pelvic floor PT. There was just some things I like would have to do to manage that urgency. I have not had any urinary urgency since the release, which is
Crazy. That's
really
wild.
weird. It's wild. And yet, do we know the connection between the mouth and the pelvic floor? The jaw and pelvic floor? Of course, you probably talk about it with your birthing clients. Relax your jaw so your cervix can open. So why wouldn't it work the reverse, right? It blew my mind. Now, did I have urinary urgency before I had babies? No. Was this like always a symptom of mine? No. But was this always some kind of stressor tension variable on my body? Yes. And by removing that, then like these other things can work better and aren't as under as much stress. So like my pelvic floor can handle it, even if it's like a little not as well as it was post pre babies, because that extra layer is just released literally. So it's been pretty eye opening and pretty wild. Again, as a 40-year-old to be like, okay, that's different. I can have a different body as a 40-year-old and my body can still change and it's still worth like looking into why I am the way I am and like ways that I can make me more comfortable and better and functional. Yes, please.
Yeah, absolutely. And for people out there who are listening that are younger than 40, don't wait. You can do
Yeah.
that now. Like you deserve to have these things now.
Yes.
Wow.
And doesn't have to necessarily be tongue tied. Maybe that's
No.
I'm finally going to eat breakfast or I'm finally going to go for a walk or see a therapist or see pelvic floor PT. Yes. Never too late, never too early.
To prioritize
Always worth
yourself.
it.
Yeah,
Yes.
absolutely. And if you're a mom, you deserve that, right? You give every single ounce of yourself to your family, to your kids. You deserve to be prioritized in your life as well because you deserve it. Because you do. You deserve that. This has been so fascinating. Just complete wild sauce. This is crazy. Is there anything else that you think our audience needs to know for someone who is considering a tongue tie for their baby, or maybe they've just put the pieces together for themselves and they're thinking, oh my God, is this me? Should I go get an eval?
I'd say the first step would be like, yeah, the most important thing would be assembling the right team. Whether you're doing this with your baby, whether you're doing this as an adult or anywhere in between, you want to find providers that understand ties, that understand the implications of ties, that understand the importance of body work and integration. And it's not just a random little cut. Again, I know you and I have like long lists for Eastern Mass and New England, but there are resources I can send you if they're like for the episode note for tethered oral tissue providers and ways to find people wherever you are. And what I also would encourage as a last thought with ties, but with everything, is if your gut, if your instinct is telling you something is not quite right with your baby, with you, don't stop until you find an answer that makes sense to you. It might not be the first person you talk to. It might not be ties. It might not be what you think it might be. But if something's not right and you know something's not right, that is worth listening to and worth following up on.
Yeah, dig into it, lean into it. Oh my gosh. Dr. Lizzie, it's always a pleasure. And I love sharing clients with you. And you are just another local practitioner that our team loves and trusts wholeheartedly. I think it's this exact reason you like to put the power back into the parents' hands. You really trust parents to know what's best for them. And you're just there to help facilitate their growth and development and align spines. So we love you and we appreciate you. And we're very grateful for all the love that you give to our one-to-one clients. And now again with our podcast listeners. Listeners, if you want to connect with Dr. Lizzie, where can everyone do that?
Sure. You can find me lots of info on my website, wholesomehealingchiro.com. You can also check me out on Instagram at Lizzie_Sobel. And I talk about ties a lot there and my own journey with ties and a whole lot of other random stuff about chiropractic and parenting and all this other fun stuff.
Fun
But yeah,
stuff. All right, you guys, go check out Dr. Lizzie's Instagram. She does document her own journey with this. I found it so fascinating. And if you like today's episode, I think that seeing these videos and watching her kind of go through that is going to just blow your mind. Connect with both of us on Instagram. I'm at Tranquility by He and at the.birth.lounge. Until next time, bye, y'all. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by He on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.